Hey there, Dr. Luke here, and let's go through a spinal segmentation class for the thoracic spine. A sign of spinal health is good flexion and extension of each segmental vertebra and segmental control of each particular vertebra. So we're not moving as a group, we're moving segmentally in flexion and extension. So these exercises are trying to retrain that and get better spinal health back. Okay, first of all, thoracic cars. So a wide base here. Breathe in and irradiate. Arms crossed. Let's go into flexion, slow and controlled, pain-free range. Rotation, lateral bend. Extension, rotation, lateral bend. Flexion, let's do this slow and controlled. We're going to go 4 to the right, 4 to the left. That's 2. What range of motion do you have active control of and ownership of? That's what we're asking here. So close your eyes, work in that best possible range of motion and space as we're rotating here. And last one to the right. Great, let's go to the left. Flex. We're not hinging at the hips here. We're just moving our thoracic spine. Mostly, obviously, the lumbar spine will come for the ride as well, but slow and controlled. It's 2. Three, and last rep. Great. Okay, the next exercise, we're going to use the wall. We're also going to use posterior pelvic tilt. So this is anterior pelvic tilt. We're creating more of a curve of our lumbar spine. This is when we're flattening our curve, we're bringing it backwards, posterior pelvic tilt, and that's what we're going to use up against the wall. So we come up against the wall, feet about 30 centimeters off the wall so that we're leaning our pelvis on the wall, and then we're doing posterior pelvic tilt, and we'll feel and flatten our lumbar spine on the wall there. We want to extend up, trying to get our thoracic spine on the wall as well. And now what we're going to do is flex and extend, trying to flex one vertebra at a time, going down to our thoracic spine and then going back. So let's do 6 reps here. We start off chin to your chest, holding your chest with your hands like this, and we're just peeling off one vertebra at a time into flexion. So we're just rolling, pushing against the wall, feeling one vertebra at a time flex off until we meet that lower thoracic spine. Once we get there, we want to then extend back one vertebra at a time, and then we're going to open up the chest, pushing into our hands and extending back. Excellent. So let's do another 5 of those. Really slow and controlled, focusing on one vertebra at a time, laying it down up against the wall. You'll notice now we've taken the lumbar spine out, that your thoracic spine doesn't have that much flexion and extension. So this is 4. Good. Open up the chest, extending back and up. 5. Flexing down 1 vertebra at a time. Down to that lower thoracic. Good, and last rep. Really using the wall to kind of push, get that flexion and control. Good, coming up, pushing into your hands as you extend up, open up the chest and lay 1 vertebra at a time. Very good. Okay, spinal segmentation on all 4s. We want to really focus on moving 1 segment at a time, starting off in extension and bringing our lumbar spine, our pelvis into posterior pelvic tilt, extending up to the thoracic area, lower thoracic, upper thoracic, now down into the neck, squeezing up, extending from lower lumbar, increasing that up the spine, segment by segment, going up into extension. Great, initiating from lower lumbar. So 3. 4. 5. 6. Now to isolate our thoracic spine, let's get onto our knees. Our sit bones will kind of sit on our heels there. Coming up, extending, initiating from that lower lumbar, and then moving our way through lower thoracic, upper thoracic, and flexing down, squeezing up, initiating into extension through our lumbar spine. You'll feel your sit bones coming back. Extending through our thoracic spine. Into flexion. Tucking the tailbone under. And back into extension. Really focus on that thoracic spine as you come up segment by segment. And 2 more here. And last one. Extending segment by segment and up into extension. Very good. Now we're going to lie on our back, yoga block in between our knees. We're then going to bring our arms forward, fists out like this. We're going to bring our neck into a chin tuck, and we're going to lift 1 vertebra at a time. Just feel for the spinous process of each vertebra until we get to that lower thoracic spine. When we come there, hold it, and then slowly come down into extension, focusing on flattening just one spinous at a time and not a group of vertebra. So one segment at a time. So let's do another 6 of those. Okay, very good. Now we've done that, we're going to roll over onto our back, yoga block between our knees, and we're going to do our thoracic extension from here. We can use our hands to help lift ourselves up, otherwise our hands go out like this. Breathe in and irradiate. And we want to lift up our shoulders, our collarbones, our neck into extension, going right up to our thoracic spine. And then we want to lower our sternum one section at a time, lowering one vertebra at a time. So that's 1, 2, 3, slow and controlled, one section of your sternum at a time, extending up, lifting your shoulders back. Five, and last one, 6. Great, let's do that over again. This time laying on our back, yoga block in between our legs. Breathe in and irradiate, lifting one segment at a time. Chin tuck, lifting and flexing our neck, thoracic spine, right to the end of our thoracic spine, and then lower one segment at a time. Okay, last rep. Slow and controlled, one segment at a time. Fantastic. Let's go back onto our tummy. Yoga block between our legs. Squeeze, breathe in and irradiate. Bring our neck up, shoulders back, chest out. Going up into that thoracic spine. And then lowering one section of your sternum at a time. But we're lowering one vertebra at a time. Another 2 reps. And lowering nice and slow and controlled. And last rep. Fantastic. Okay, spinal segmentation. Let's isolate the thoracic spine, coming onto our knees. Sit bones will feel our heels. Extending. Start off, initiate from that lower lumbar into posterior pelvic tilt, flexing through our lumbar spine, coming up to our lower thoracic, upper thoracic, and then into our neck, and initiating extension. Anterior pelvic tilt to our lumbar spine, coming up and extending up through our lower thoracic, upper thoracic, and then our neck. So let's do 6 reps. Okay, 4. 5. And last rep. Slow and controlled. Very good. Okay, thoracic cars, breathe in and irradiate. Coming to flexion. Rotation. Lateral bending, extending. Rotation, lateral bending and flexing. Making sure we're not hinging from the hips. Hips are stable. And we're creating the biggest circle possible. What movement do you have ownership of? That's what we're asking. So just close your eyes, slow and controlled. So 4 reps to your right and 4 to your left. We're just ending that now, coming up into that neutral position. Now we go to the left. 2, 3, and last rep. Really, this best rep, this last one, really finding that best possible range. And done. Fantastic. So that's how we do a thoracic segmentation, flexion and extension class, really trying to retrain your spine and spinal health. So give it a go.